We don't know when that next infectious disease threat is coming, and we need to make sure that we're as ready as possible as soon as possible. So this model is really an effective one for pushing out knowledge in every single federal region in the country.
NETEC has provided just a tremendous amount of support through education or just coming alongside, like an elbow-to-elbow collaboration to just give us best practices, the ability to just ask questions whenever we want, and they provide such a tremendous amount of expertise.
During the Ebola crisis of 2014, facilities in 3 U.S. cities stepped up to help treat patients while relying on biocontainment expertise and training to shield the public. After the outbreak, the National Ebola Training and Education Center was created to distribute knowledge and skills to hospitals throughout the country.
We've looked to Bellevue, Emory, and Nebraska as the subject matter experts to really guide us in our creation of our biocontainment unit first and foremost. You know, we're not recreating the wheel. We're going to hospitals that have taken care of patients and seeing what worked for them, what didn't work for them, and we can then modify that for our hospital.
It's certainly successful because the programs at the heart of NETEC leadership are those with experience. They're respected, they've done this successfully. But I'm really impressed by the commitment of the programs to share knowledge, to push out best practices wherever they're found, to share what they've done, as well as share the lessons learned as they learn them, so that not everyone has to make the same mistakes.
NETEC's specialized training has expanded the shield of protection to 10 regional centers of excellence, with the goal of ensuring the United States will be better prepared when the next outbreak of special pathogen occurs.
Then on a regional level for Region 7, we're doing drills across the 4-state region. We're collaborating, we're setting up backup mechanisms for in case we get overwhelmed at one facility or the other.
If I have a question, I can reach out on the network and get an answer from, not just one person, but multiple centers.
NETEC is a successful model because it very much is similar to a typical tiered system, such as with trauma or stroke or cancer, where you have institutions that serve as resources, but also can be clinical transfer centers if an individual at a frontline hospital or a group of individuals at a Ebola treatment center or any sort of special pathogen feels that they need a resource for either managing the patient there or the ability to transfer the patient to a biocontainment unit if that's the type of care that that individual patient needs.
Our folks tell us who have come to our simulation courses is they've not spent that kind of time before, dedicated time in their personal protective equipment doing various tasks. And that to them I think is very enlightening.
Well, I think NETEC's a successful model because it pulls together resources, pulls together talented individuals, and really has created a national resource that allows us to leverage our skills, our abilities, our enthusiasm. Because if we don't have that infrastructure, if we don't have that coordination, we're not going to be able to continue to maintain the trajectory that we're on and that we need to be as a country.
But to think now, would we have more people raise their hand to come to work in a pandemic because they're more confident with their personal protective equipment?
NETEC is expanding its training, adding more online courses and exercise materials to extend the shield of protection in order to prepare for whatever pathogenic infectious disease comes next.
I think by nature, risks are evolving over time. We don't know exactly what the risks will be in the future, and so preparedness isn't a box that you complete and then move forward and forget about. We can prepare for this. We can take care of these patients safely and effectively in the U.S. and provide outstanding patient care while keeping our staff safe as well. And I think NETEC is a really core piece of that preparedness.
If the United States ceases to move along the line of emergency infectious disease preparedness, ceases to devote the resources so that healthcare workers and their administrative support do not continuously practice how they will manage an infectious disease outbreak, we will not be able to manage the inevitable infectious disease outbreak when it occurs on the United States shores.
As a nation, we still have critical gaps that exists, large geographical regions that need much more capacity. So success for us, I think, will be when there's a much more broad coverage throughout the U.S. of readiness.
So having a system that allows for high-level containment, patient care for those with emerging pathogens really is a frontline defense against the emerging threat of infectious disease, which we know is at least going to stay the same, if not actually increase in the coming decades. We are working so hard on so that other hospitals, other treatment centers in our regions have capability, and we're expanding the ability of the nation to care for highly infectious patients if we have a larger scale outbreak.
I'm able to take from other centers what works for them and how to apply that to what we have in Spokane and make it work for us. That we are constantly looking ahead of what can we be prepared for and how can we protect our communities throughout this nation with whatever the next pathogen may be.
We have started a great national program involving now 10 regional centers, on the order of 50 to 55 state-designated Ebola treatment centers are now along the way of developing the capability of caring for patients with serious communicable diseases.
The National Ebola Training and Education Center, I think it's a great collaborative between these three institutions and now engaging other regional Ebola treatment centers to make sure that we have the right information, to make sure that we can meet the learners where they're at. So we never want to be caught off guard again, and that's what NETEC is. That's why we have NETEC.